Subarachnoid hemorrhage refers to bleeding within the subarachnoid space, which is the area between the brain and the tissues that cover the brain. The subarachnoid space is the space where the cerebrospinal fluid circulates, and it's responsible for protecting your brain from injury by serving as a cushion. A hemorrhage in this space can cause a coma, paralysis, and even death. When subarachnoid hemorrhage develops, it has several symptoms. The main symptom is a sudden, severe headache, which is more intense at the base of the skull. It is often described as the worst headache people have ever experienced. Some people may even feel a popping sensation in their head before the hemorrhage begins. You may also have neck pain, numbness throughout your body, shoulder pain, seizures, confusion, irritability, sensitivity to light, decreased vision, double vision, nausea, vomiting, rapid loss of alertness. The symptoms of subarachnoid hemorrhage come on suddenly, and you may lose consciousness quickly. Seek emergency medical attention right away if you experience any of these symptoms combined with a severe headache. Subarachnoid hemorrhage can occur at any age, and some people are even born with cerebral aneurysms that can lead to this condition. According to the Internet Stroke Center, women are more likely than men to develop brain aneurysms, and thus subarachnoid hemorrhage. Smoking and high blood pressure can also increase your risk of developing an aneurysm. Drug use, particularly methamphetamine and cocaine, dramatically increase the risk of not only developing an aneurysm, but having subarachnoid hemorrhage. 1 in 50 people is estimated to have an unruptured aneurysm in the United States. You should talk to your doctor about your risk if you have a history of brain aneurysms. If you have aneurysms, it's important to see your doctor regularly to determine your risk for hemorrhaging before subarachnoid hemorrhage develops. To diagnose a subarachnoid hemorrhage, your doctor is likely to recommend CT scan. This imaging test can detect bleeding in your brain. Your doctor may inject a contrast dye to view your blood vessels in greater detail, CT angiogram. About 35% of patients die after the first aneurysmal subarachnoid hemorrhage, another 15% die within a few weeks because of a subsequent rupture. After 6 months, a second rupture occurs at a rate of about 3%/year. In general, prognosis is grave with an aneurysm, better with an arteriovenous malformation, and best when 4-vessel angiography does not detect a lesion, presumably because the bleeding source is small and has sealed itself. Among survivors, neurologic damage is common, even when treatment is optimal. A subarachnoid hemorrhage is a medical emergency. Immediate treatment is essential to help reduce the risk for permanent brain damage. The main goal of treating a subarachnoid hemorrhage is to stop the bleeding. Often, a doctor may do surgery to place a small clip on the blood vessel to stop blood from leaking into the brain. All patients should be monitored in the intensive care unit after an intracerebral hemorrhage. Improving cerebral tissue perfusion. Monitor closely for neurologic deterioration, and maintain a neurological record. Check blood pressure, pulse, level of consciousness, pupillary responses, and motor function hourly. Monitor respiratory status and report changes immediately. Implement aneurysm precautions, immediate and absolute bed rest in a quiet, non-stressful setting. Restrict visitors, except for family. Elevate the head of bed 15 to 30 degrees or as ordered. Avoid any activity that suddenly increases blood pressure or obstructs venous return, e.g., Valsalva maneuver, straining. Instruct patient to exhale during voiding or defecation to decrease strain. Eliminate caffeine. Administer all personal care, and minimize external stimuli. Apply anti-embolism stockings or sequential compression devices. Observe legs for signs and symptoms of deep vein thrombosis: tenderness, redness, swelling, warmth, and edema. Teaching patients self-care. Provide patient and family with information to promote cooperation with the care and required activity restrictions and prepare them for patients' return home. Identify the causes of intracranial hemorrhage, its possible consequences, and the medical or surgical treatments that are implemented. Discuss the importance of interventions taken to prevent and detect complications, e.g., aneurysm precautions, close monitoring of patient. As indicated, facilitate transfer to a rehabilitation unit or center. Primary prevention is the best approach. Hypertension. Control of hypertension, especially in people older than 55 years old, reduces the risk. Stroke risk screenings. Stroke risk screenings provide an ideal opportunity to lower the risk by identifying high-risk individuals or groups. Education. Educating patients and the community about recognition and prevention can reduce the risk.